My name is Macy Ross. I'm one of the medical oncologists in breast health and the medical director of integrative health program at Massey Cancer Center. In recognition of October being Breast Cancer Awareness Month, we wanted to highlight the role of the nurse navigator. And so we have a special guest with us today, Donna Wilson. She's a master's trained clinical nurse and our nurse navigator in breast health at Massey Cancer Center. So welcome, Donna. Thank you for joining.
Yeah, thanks for having me. Good morning.
So just want to share with people the importance of the nurse navigator role. So can you tell us just a little bit about what the nurse navigator does and their role in patient care?
So at Massey Cancer Center, we have a site-specific nurse navigator program, and I'm with the breast health team. And our role is to support the patient and their family members as soon as they're diagnosed, and sometimes at high risk. So I'm with the breast health program, and we're all oncology nurses, and our role and our part of the team is to work collaboratively across the entire spectrum of the treatment team, from radiology to med-onc to surgical oncology to radiation oncology, to let the patient know what the resources are and educate them about their disease process and what to expect.
That's great. And how long have you been doing this role, Donna?
I have been an oncology nurse navigator for 12 years. I started at another organization and came to Massey about 4 years ago. I've been an oncology nurse for 25.
We're lucky to have you.
Oh, thank you.
And can you tell us a little bit about what got you interested in nurse navigation, how you came about this position and how you got started?
I actually fell into this role when I was working bedside as a nurse. A bed leaked hydraulic fluid, which messed up my back, so I can no longer work as a nurse at the bedside or in any position where I have to be able to push, pull, or lift. So I was on light duty and was looking for a position that could warm my heart and take care of what I need to do as a nurse, because I love patients, and the oncology nurse navigator position came up. And so I started researching that. And it really is a role where I can advocate for my patients, where I can use my nursing skills and my knowledge. So that's what drew me to the oncology nurse navigator. I also I shared my husband's journey when he was diagnosed with cancer. So I learned what it was to be the family member of a cancer patient. And that's what really drew me to this role, because we are such strong advocates for our patients. And patients just don't know what to expect. And so the nurse navigator, we really help them to know what to expect at the visits, why we're doing these tests. So it's a lot of opportunity for us to educate the patient so that when they meet with the providers, they're better able to hear what the providers are telling them about their treatment.
Yeah. And can you tell us a little bit, so you're often one of the first people that our breast cancer patients encounter when they first get their cancer diagnosis. Can you tell us a little bit or share about what patients should expect when they come to Massey and they first speak with you?
Absolutely. So what we try and do across the board with the entire navigation program is when a patient shows up and on a schedule or is diagnosed, we have a process where the navigator the patient is identified to the navigator. So we try and call the patient before they even step foot on our campus to check and see how they're doing. And a lot of times when I call that patient, I identify myself as, I'm your breast nurse navigator. I'm here. How are you doing? I usually will talk to them shortly after they've been told they have a diagnosis. And I tell them that I'm here to support them. And then I listen. A lot of that first phone call is listening to how the patient is doing. What are they expecting? And then I tell them what to expect at the clinic visit. I let them know that they can eat and drink. Sometimes patients think that they need to be fasting, and so they're going to show up at a 10 o'clock appointment and not had anything to eat or drink. And we need them to eat and drink because, you need to have food in your belly so you can listen. So it's a lot of education. I let them know what to expect. I will get a family history from them. I will tell them the different roles of the team members, our treatment team. I'll explain what a surgeon, medical oncologist, radiation oncologist. For the breast cancer patient, they may have a family history and identifying that they may need to meet with our genetic counselor. I'm listening for cues to see if there's any barriers to them getting treatment. By that I mean, are they worried about their jobs? Are they worried about having to lose time from work? In the time of COVID, do they have children that are at home that they're having to do remote schooling? So a lot of what I'm doing is I'm listening, and just by allowing that patient to explain what's going on in their life beyond the cancer diagnosis and what their worries and their fears are, I'm calming their fears and identifying ways that we as a team can support them through this journey.
That's great. And I love that you start with listening, because that's so important, because I'm sure everybody's experience is very individualized.
Very individualized.
Yeah, you mentioned some of the barriers potentially, and are there any resources at Massey that you can speak to that might help a person navigate depending on what their barriers are as they start their cancer journey?
Oh, absolutely. We have all kinds of ways to help our patients. We have social workers. We have our integrative health, which you are very much involved in, to help with the spiritual side and just feeling good and understanding. We've got education. We've got the medical legal partnership if we identify a patient has legal issues. What else do we have? I'm forgetting something. Social work. We do education. So work across the research nurses. So the clinical research, sometimes patients will call and are coming here because they're interested in a clinical trial. So we have, I can reach out and the physicians will reach out to the research nurses. We have all kinds of opportunities and ways to support our patients throughout all of the barriers. It depends on what barriers that we identify, but right. I can't think of any barrier that we've come across that we haven't been able to help.
Yeah, I would agree. I mean, I think with the, there's so many resources here. I think that the navigator role is crucial in helping patients, funnel through or navigate through, I guess, for lack of a better word, all the different resources. And, the clinical trials, I agree. I would echo that. We're really expanding our clinical trial portfolio. And so that's a great resource for patients as well, so they can learn sort of what other options they may have to optimize their care. Well, that's great. And can you give any advice for a patient who's just been diagnosed? Is there anything that you would impart to them?
I encourage them to stay off of the internet. And if they do want to go on the internet, I tell them not to Google breast cancer, because there are different types of breast cancer and it depends on your type of breast cancer. So I educate them about that. If they are knowledge seeking and they want to go on the internet, we have a wonderful flyer that has been put together that gives us accurate websites to go to. So I will share that with them. I encourage them to get a spiral notebook or some type of notebook and start writing down their questions. And I encourage them that no question is stupid. There are no stupid or silly questions. This is something that they did not have on their bucket list to do. So I encourage them to write their questions down so that they're prepared. And some questions will be for the surgeon, some questions for medical oncology. So I try and steer them in that direction. I also encourage them to find out who their support systems are and to lean on their support persons. And when somebody says a family or a friend and they want to help, to go ahead and let them know how they can help. We are able to have one support person with them at a visit. So I let them know that due to COVID, we are limiting the amount of people in the clinic. I encourage them to bring someone with them. If they have more than one, then we make provisions so that their friends can listen on the phone, or the family members. I encourage them about support groups or with a counselor. Our social workers have lists of counselors available for them. So it helps to be able to talk about it and to know what your support are. So those are the type of advice that I give patients. It's pretty much listening to see what are they looking for. But those are some of the advice that I give patients when they're asking how they can get through this.
Yeah, I think that's great advice. And there's so much information on the internet. I think sometimes it can be overwhelming trying to sort through what's accurate and what's not. So really relying on, evidence-based guidelines and websites and helping patients to find those, I think is really important. You mentioned that a patient who's entering into their cancer journey may have different members of the team or different types of doctors that they encounter. And there's been a lot of emphasis on multidisciplinary care. So can you share with us a little bit about who makes up a multidisciplinary team for a breast cancer patient?
Absolutely. So the first provider that a breast cancer patient may encounter outside of their gynecologist or primary care provider would be our radiologist, a women's radiologist, where a woman would come and get her mammogram. So here at Massey, the breast biopsy is done in our women's imaging center. So our women's radiologist will give the patient their diagnosis. So that's the first provider that patient is going to come in contact with. We have a breast cancer collaborative care clinic that we run here at VCU, where the patient can meet with the entire team. So the next provider that this patient may, after they talk to me or one of our new patient coordinators, is get them scheduled in a surgical oncologist. The surgical oncologist is going to talk to the patient about taking out the cancer out of her breast. And then medical oncology is the provider who's going to talk to the patient about medications. Medications is important to know that not everybody needs chemotherapy. There are medications we can give for our breast cancer patients. So medical oncology is medications, and I encourage patients to remember M&M, medical oncology, medication. Radiation oncology is another piece of the puzzle to take care of a patient, and radiation is a part of treatment that we provide to our breast cancer patients. So I will explain radiation oncology, and we have a team here. If a woman wants or needs a mastectomy and wants reconstruction, then she may need a plastic surgeon. So we have our plastic surgeons here who work alongside with our surgical oncology. The other providers that a patient has in her toolbox is our social workers, who can help with issues outside of the treatment and help the patient to deal with having a breast cancer diagnosis and living life and taking care of all the things that patients have to take care of. We can have men who have breast cancer. So if we have a man who has breast cancer diagnosis, think about it. He is going to a women's imaging center, and it's all pink and girly. So we have to support our men patients. Uh-oh, my computer shut off. Can you guys still see me? Because I can't see you. So sometimes we have patients who are men. Men get breast cancer. And so if you think about it, a man is going to, for some reason, have to have imaging, and he will have to go into a breast imaging center, which is all girly and pink. So we have those patients that come in, they will get imaging, and they still need the same team, med-onc, surg-onc, and rad-onc. In addition to who I've already mentioned, we may also have to have that patient meet with a genetic counselor. So the geneticists here at VCU, we actually have genetic counselors who will meet with a patient at a consult. We'll go over their history and their family history, and then the patient and the geneticist will decide whether or not to run the test. If so, we'll go ahead and run the test. The other folks who could be part of the treatment team is we have our lymphedema specialist. So if a patient is going to have a mastectomy or anything that has to do with the lymph nodes, we will, before surgery, have them meet with our lymphedema specialist, who will talk to them about the importance of exercises and range of motion. They will also measure the arms to make sure that they don't have any swelling, which is lymphedema. In addition to other folks that I've mentioned, if you have a young woman who is going to have to get chemotherapy, then we go ahead and facilitate that patient seeing one of our fertility specialists, because chemotherapy can affect that patient having children. So we will have them meet with our fertility specialist. So I don't know if you're keeping count, but how many providers so far have I named? Can you imagine how overwhelmed that patient is? So that's where the nurse navigator comes in, that I'm there to help them understand why all of these pieces of the puzzle come together to take care of them, to bring them back to whole life and good health and take care of their breast cancer. And then if the patient qualifies for one of our clinical trials, then that patient may also meet with one of our research nurses. So it's a whole team that that patient has to meet with. And I'm there to help that patient understand who all these providers are and where they fit into the puzzle of taking care of that patient. So it's a lot of talking, a lot of education, which is what I love. I can still be a nurse and use my nursing knowledge and support these patients without actually sticking them with needles and doing wound care. I'm using my nursing knowledge as an oncology nurse to support these patients.
That's excellent. And I want to circle back for a minute because you mentioned the role of the clinical trial. And can you tell us a little bit about the clinical trials at Massey and how, if somebody enrolls on a clinical trial, how that might be different or not different from their standard care that they would receive if they didn't go on a clinical trial?
So our breast health team meets every week and discusses all of our new patients in what we call a breast health conference. Some people call it a tumor board. And at that conference, we are discussing patients, and the entire team is there. Medical oncology, surgical oncology, radiation, our clinical research nurses, our geneticists, pathology, radiology, and nurses. So when we discuss patients, the providers are looking to see if they qualify for our clinical trials, and the clinical research nurses are. Our clinical trials can be treatment, meaning they're about medication. So it's all they may be getting a medication that is not approved, or it could be quality of life. We have clinical trials that talk about heart health. We have clinical trials that talk about sexuality. The difference in it, and Dr. Ross, you may be able to explain this better than I for the patient, is as far as getting treatment, if a medication is not approved yet, but is in a clinical trial, the patient can be treated with that. Where if they were somewhere else in the community and the community wasn't involved in that clinical trial, the patient will be able to get that. Regardless of whether or not a patient decides to go on a clinical trial here at Massey, we're going to take the very best care for them. If a patient is given the opportunity to be on a clinical trial and decides they don't want to do it, it's not for them, we're still going to take very good care of that patient and provide them with the standard of care and everything we can to take care of them.
Yeah, that's excellent. And I'll just add a couple pieces to that in terms of the clinical trials, the treatment trials. So sometimes I think there's a misnomer that patients may be assigned to placebo or not get the standard treatment. So all of our treatment trials involve either standard of care, so that would be the standard, treatment, whether it's chemotherapy or surgery or radiation that they would get anywhere else, or it's standard of care plus an additional therapy. So there's no placebo trials when it comes to treatment. So I just want to emphasize that patients who are interested in clinical trials who enroll, they're getting at least the standard of care. And as you mentioned, Donna, sometimes an opportunity to receive another either medication or treatment option that hasn't been approved yet by the FDA or completely adopted as standard of care, but has had a lot of evidence leading up to this point that it may be effective. So so that's great. And can you tell us a little bit? So you had mentioned earlier the role of the caregiver, and you had mentioned that you had some personal experience in that role. And can you share with us any advice for caregivers of women who have just been diagnosed with breast cancer? How can they support their friend or family member, or what can they do?
Listen to what the patient needs. Sometimes we have our own agenda because we may have already been through it. For a lot of women, a lot of our patients, what I hear is that once their diagnosis is out there and people know about it, people start giving them unsolicited advice. So if the patient doesn't ask you for advice, don't give it to them. It's kind of like when you become pregnant. Strangers will think that they can automatically touch your belly or just start telling you their stories of labor. That's what I hear a lot. So if you are a friend or a caregiver of a breast cancer patient or any cancer patient, don't give them advice unless they ask for it. It may be very well-meaning, but they may not want to hear it. Listen to see what they need. If you have a friend who has breast cancer, maybe offer to leave food. We had a patient who had a cooler on the outside of her front porch that was stocked so it stayed cool, and her friends would bring food and leave it there, so that on days when she had a lot of tests or had appointments or was getting chemotherapy, it would be there and she wouldn't have to come home and fix a dinner. Patients who are female who have breast cancer, which is most of them, are women, and we know that women have a lot of roles, taking care of children and their spouses and the home, and they may even have elderly parents, so they're that sandwich generation. So just ask, what can I do to help? And at first, the patient may not know what you can do to help. The best thing I can do is say, ask what you can do to help them and be there for them, offer to give them a ride, offer to watch the children, wherever that patient is and what the needs could be.
Yeah, that's excellent advice. I know too that some of my patients have shared with me some different apps that are sort of interesting about meal preparation, as you had mentioned. I know there are some apps where people can sign up to sort of prepare meals if that's something that a patient has expressed, might be helpful to them. So lots of different opportunities there. Well, that's great. Lastly, I just sort of wanted to go through step by step and sort of see if you could give us an example to sort of walk us through. So if a patient, let's say a woman goes for her regular routine screening mammogram and there's something identified as abnormal, what would you say are the next steps? Generally, she'll be contacted by the radiologist potentially for additional imaging, and let's say that leads to a biopsy. And then what happens after that? Or can you share with us maybe an example of a patient who was going through this and sort of what that looked like from day to day or week to week, what she should expect?
Yes. So if you are going for a screening mammogram, I think it's important to note that you don't need an order for that. If it's just your annual screening mammogram, you don't feel anything in your breast, you do not need to contact your physician and get an order. You can make an appointment and get a screening mammogram. So if you go for your screening mammogram and then you get called back, let's say they see something. So a lot of times here at VCU Massey, our radiologist will have the patient wait and they make sure that the pictures are good. They may offer to give them additional imaging that day, so it becomes a diagnostic mammogram. We do need an order for that. So when you register for your mammogram, for your screening mammogram, they always ask who is the provider that's going to get that report. Is your gynecologist, is your PCP. So once we identify that there's something there and we need to do additional imaging, it's a diagnostic mammogram. So they would do a diagnostic mammogram, and if they see something in a diagnostic, then they will do a biopsy. And here at VCU Massey, that's all done, like I said, on our women's imaging. The time for the turnaround, once we know, is about 24 to 48 hours to know what they found when they inserted that needle into your breast to see what is the specimen. If it's a breast cancer, then the radiologist would call you or have you come in. It's up to you. In the day of COVID, a lot of times it's a telephone call. and they will tell you. But if the patient really wants to come in, I will say that our radiologist will do a face-to-face. It's a scary time. So they will give them the diagnosis, and at that time, we give them an appointment. So the appointment would be made with usually a surgical oncologist. Here at VCU Massey, we have the Breast Cancer Collaborative Care Clinic, and at that clinic, we will go ahead and put that patient in, and that patient will come at one visit and get to meet with the entire team. So that's when I become involved at the time of diagnosis. And I will call the patient, explain the Breast Cancer Collaborative Care Clinic, and ask the patient if they want to attend that clinic. And so at that clinic is when, step by step, they'll arrive. They will meet with the surgical oncology nurse practitioner who will do a history and physical exam. The patient will meet with the surgical oncologist who will explain the surgical options. Then they will meet with medical oncology who will discuss about medications, and then radiation oncology who will explain and discuss about radiation. Also at that clinic, we have our social worker who will assess and see if there are any needs that we need to be aware of to support the patient with issues in life. If we need this patient to have genetic counseling, that's when we'll schedule that. If the patient needs additional imaging, sometimes there's a breast MRI that needs to be done, we'll schedule that. If the patient is young, recently I had a young woman who was 32 years old who actually felt something, so she had an ultrasound. They tried to do a mammogram. Her breasts are very dense because younger women's breasts look very white for a radiologist, so she had an ultrasound, ended up with a biopsy. She was seen by our surgical oncologist, medical oncology. Unfortunately, she's going to need chemotherapy. So that patient, we've got her in to see fertility, so that she saw surgical oncology and medical oncology on a Friday. And then on that Monday, I had her scheduled to meet with fertility so that she could go ahead and start that process. She also qualified for a clinical trial. So I explained that to her, and our clinical research nurse called her on Monday afternoon. I talked to her again, answered her questions because she was feeling very overwhelmed. She has enrolled in a clinical trial and is getting chemotherapy before surgery. So we were able to get all those pieces and puzzle pieces together so that we could get her to treatment.
Okay, that's excellent. Thanks for sharing. And is there anything else that we haven't discussed or that I haven't asked you that you want to share with those watching?
I think that having a cancer diagnosis rocks your world and turns it upside down, but you can get through it. And we will take very good care of you if you come to VCU Massey. We've got a great team of caring providers and nurses, and even our clerical staff cares about our patients. I cannot tell you how many times I've had either our new patient coordinators, who are the ones that take the phone calls when people call in, or our front staff, our staff that's at the front. When you walk into the clinic and they register you, they all care about our cancer patients. So it's a scary time, but we're all here to support them.
Great. Well, thank you so much, Donna, for sharing your experience and your advice. And we're glad that we could highlight what the Nurse Navigator does today because it's such a valuable role and you're such a valuable member of our team. So with that, I think we'll conclude the interview, and we'll see everybody again next month.